Okay, good evening, everyone. My name is Michael Lewis. I am the Director of Disability Policy here at MDA. Thank you all very much for joining us for our November Advocacy Institute. Tonight we're going to be discussing financial security, accessing federal benefits and programs. We're gonna go with some introductions and housekeeping items. Um, and then we'll have our first panelist talk about the supplemental security income, social security disability, and marriage equality and reform efforts for those programs. And then our other panelists will touch on the ACBS Access Act, the ACBS Relief Act, and ABLE accounts, and then we will have questions at, at the end. Next slide, please. So, just a few housekeeping items. On the bottom left-hand corner of your screen, you'll see a little icon, a bubble with CC in the bubble. If you click on that icon, you can activate the closed captioning for the webinar. And on the other side of the screen, the far right hand side, you'll see a little bubble. Click on that. That is the chat button. And if you have questions, feel free to type them in the Q&A chat. Next slide. So tonight we have two panelists joining us. John Burdick, who was a divisional supervising attorney with Community Legal Services of Philadelphia. And we are also going to be joined by Grace Hart, who is the Disability Senior Policy Aide for U.S. Senator Bob Casey of Pennsylvania, who is the chair of the Senate Special Committee on Aging. Next slide. All right, first up we have Jan Burdick. Take it away, Jan.
Michael, thank you for that wonderful introduction. And it's lovely to see you all tonight. You have kind of a Pennsylvania heavy panelist series, but I'm excited to be part of it. So I have a lot of slides here. I'm not going to go over every single thing. Some of these are just more information if you need it, but just getting started, we're going to talk about Social Security and SSI. Now, generally, when people talk about Social Security, they might be talking about two different programs. The one is Social Security Old Age Survivors and Disability Insurance. Some people call it the OASDI program or SSDI program. And the second program, which is Social Security's poverty program, is called Supplemental Security Income or SSI. Both these programs are administered by the Social Security Administration. They both provide a cash income and importantly connect people with health insurance most of the time. SSI also administers Medicare. Now, just kind of showing you that, they administer SSI. In order to qualify for it, we're going to talk more about this in a minute, you either need to be over 65 or have a disability. First, OASDI, there's a couple different ways. You can be in retirement, you can qualify over disability, or you can qualify because somebody else qualified and you are their spouse or dependent. This is survivor's benefit or dependent's benefits. Next slide. This is just a visual representation, which I think can be helpful because SSI is kind of its own thing over Title 16, whereas Social Security benefits can be all the different programs that we just talked about. So why is it important? So whether you're going for Social Security, the OASDI program or SSI, both these programs will provide people cash income as well as connection to healthcare. With Social Security, after a waiting period, people will be eligible for Medicare. With SSI, in most states, it allows automatic Medicaid eligibility, and most states don't require people who are getting SSI to go through any sort of reapplication process to keep their Medicaid. Next slide. So what are the eligibility factors? So for SSI in particular, it's not enough to establish that you're age eligible or you have a disability. You also have to be financially eligible, meaning you have to be poor enough. This program is limited both on income and with assets. And the asset limit is very, very low. It hasn't been updated since the 80s. So you can't have more than $2,000 of assets for single adults or $3,000 for couples. And for income, you're looking typically the max value of the benefit for a single person is $914 a month as of 2023. And for a couple, there's a reduction, which we'll talk about later. It's $1,371. And so for income, you can't make too much more than that in order to keep that cash benefit. Next slide. So I work as a legal aid attorney who helps people qualify for SSI and SSDI all day long. So I'm going to spend a few minutes talking about some basic principles of proving disability, though there's a few extra slides here, which I'm probably not going to have time to cover, but I'm going to leave there, and I'm open to ask, if anyone has questions after my email was at the front of the slide deck, I'm happy to talk to people. But first of all, the concept of disability in Social Security land is different than it is in the real world. The definition they have for eligibility is the inability to engage in substantial gainful activity because of mental or physical impairment that is expected to last 12 months or result in death. Now, there's a couple of components here. One is substantial gainful activity, which is whether or not you're working to a certain amount. Another is whether or not you have a mental or physical impairment. It's not enough to have a problem or a disability. It needs to be diagnosed by particular medical providers, and it needs to be lasting 12 months or longer or death. Next slide. In order to assess this, Social Security follows what's called a 5-step sequential evaluation, which I lay out here, which I think is helpful because sometimes they get to odd results, which I think are easier to understand if you understand the analysis that Social Security is doing. The first one is, are you engaged in substantial gainful activity, which is the fancy word for work. Could you go back to the last slide? Actually, thank you. We're going to talk about the definition of that, but it's, are you working enough? And if you are working enough, it doesn't matter how impaired you are, you're not going to qualify for Social Security benefits. The second is whether you have a severe impairment. Again, this is a medically determinable impairment. And if so, you'll go on to step 3, where Social Security has what's called the listings. The listings are, they've separated the body into 14 different parts, and they've said, if you have a mental or physical impairment that meets these particular criteria, we're going to go ahead and say you're eligible. The listings are very, very specific. They have a lot of specific rules. For example, if you have a seizure disorder, it's not enough to be diagnosed with epilepsy and have a lot of grand mal seizures. You need to have those seizures at particular intervals in order to qualify, 30 days apart, and be hospitalized for a certain amount of time. And so it's frequently people do not qualify for the listings, not because they don't have severe impairments, but because they don't meet these very specific criteria. And then the last 2 steps are even more complicated. So if you don't meet a listing, you can still be found eligible, but they agency considers whether you can go back to any past work or if there's any other jobs in the entire country you can do. And they do that by considering data in a book called the Dictionary of Occupational Titles, which hasn't been updated since 1992. Next slide. So breaking this down a little, so substantially gainful activity, that is, a legalese phrase for Social Security, which indicates that a person needs to be earning $14.70 per month or more. If you are, you won't be eligible for SSI disability benefits, no matter how impaired you are, with the exception that the SGA limit for people who are blind is actually higher. It's $24.60. Next slide. Severe impairment, as I mentioned before, it's all about diagnosis. So one thing that's really important to anyone who's engaging in this process is that they are seeking medical treatment. And the system doesn't really encompass anything outside of Western medicine very well. So you need to be seen by a licensed physician, a physician assistant, therapist doesn't work, a psychotherapist doesn't work. And there's some impairments that are trickier than others based on how the Social Security rules look at health. So it's not necessarily always connected to medical reality as it is on the ground today. It's what the Social Security's rules were when they were written. Next slide. Now, I mentioned the listings of impairments before. I just wanted to note that I have a link to them here on this slide in case anyone wants to take a look at them. As I said, they are very specific. Some people do qualify under the listings, but often the criteria is too specific to meet the reality of their actual impairments. Next slide. And we can move past, next slide again, sorry. Now, I mentioned before that there is this step 5, which is important because this is where they consider, whether you could do your past work or any work going forward. I'm going to talk about some of the policy issues that people are considering right now, but I want to flag this because what happens here is kind of interesting. It's where the agency has to prove that people in this process could do jobs somewhere in the country. And as I mentioned, the data they rely on hasn't been updated since the 90s. So one of the areas that people have been asking for change is considering whether it would be possible for the agency to use more updated data. There's been some interesting news stories about this in the Washington Post that some people may have seen, that some of the jobs that they say people can do that they use to deny them benefits are actually so outdated they don't exist anymore. One example would be addresser. In this book, the Dictionary of Occupational Titles, they consider the requirements of a job where people would hand address envelopes. But, this data came from before computers really dominated, and now people don't really hand address envelopes. So this isn't a real job, and it shouldn't be keeping people from getting benefits. Next slide. And in order to look at this data, they look at something called vocational experts. Here's some more information about vocational experts. I'm not going to go into significant detail in it here for time purposes. Next slide. And I'm going to skip this one as well, please, and the next one. So if you are supporting somebody or you are somebody who's going through this process, one thing I wanted to mention is there are sources of evidence that are more compelling than others. So one thing that Social Security really focuses on, as I mentioned, is, Western medical evidence. They want diagnosis from acceptable providers, as well as sleep studies, therapy notes, any inpatient treatment, lab work, x-rays. If you are applying or working with someone who's applying, it's really important to make sure that Social Security is getting all of that medical information. And if you provide them the name of the providers, they are obligated to get that information for you. But there's also other evidence that can be really, really helpful in these cases. One is any evidence from school, particularly if you're working with someone who is 18 or under and is still in school or in college or a young adult. School records, which sometimes will include individual education plans, can be extremely helpful to establishing someone's functional limitations, which is relevant to whether or not they meet this disability standard. Other thing is any evidence from current or former employers. Social Security even has special forms for employers to fill out, to talk about, what your skills are and what your limitations are, which Social Security will consider when looking at a claim. But also things you create yourself. If I'm representing somebody who has a seizure disorder, I ask them to keep a diary of every time they have a seizure, because many people don't go to the hospital or see a doctor every time they have a seizure, particularly if it's an ongoing issue. It just doesn't make sense. The same thing with pain. If you have chronic pain or conditions that cause pain, those kinds of journals are really good evidence. So, when you're thinking about what kind of evidence to bring to these cases, you can be creative, and there's a lot of different things that can be probative. Next slide. And if you don't have enough evidence or evidence that Social Security finds acceptable, they will often ask people to go see consultative examinations. This is where they'll ask someone to see a doctor that's paid for by Social Security. These examinations can be helpful in that those doctors are acceptable medical sources, and they can diagnose things that maybe it's clear that you have, but you're not seeing the type of doctor, the appropriate kind of doctor who can diagnose for it. But otherwise, they tend to be very short. They tend to be conducted by people who are not specialists in whatever is going on with you. So for all other purposes beyond the diagnosis, they tend not to be that helpful. Next slide. I'm going to skip this slide, and I believe, and so this is just so people can see the process. When you are applying, you start by applying in the field office. Typically, you can do that by over the phone. For certain people, there are online applications. For many, there are not. But I wanted to just show you all the different steps in a claim, which is initially your case will get reviewed at a state agency called a Disability Determination Service. Only 30% of claims are approved at this level, so most people are denied. And then if the first time they appeal, there's something called reconsideration. Again, most people are denied. Almost 90% are denied at reconsideration. However, almost 50% of all people who appeal and talk to a judge will win at that level. So I say this because some people get deterred after their first denial and don't continue with the process, but I really recommend that anyone appeals at least twice if they believe they have a qualifying disability, because you really want to get to the ALJ level, the judge level, in order to get approved. Next slide. So briefly, I want to talk about some policy issues. There's a number of different policy issues that people have been pursuing to update this outdated program. One is the maximum benefit for SSI is only $914, and many people who receive this benefit are living below the poverty level. So there is pending legislation called the 2100 Act, which would raise that, which would be really helpful and important, because it would be really great that everyone who qualified for this was not on a poverty level. I talked earlier about, for SSI in particular, the income and asset limit is extremely low. Individuals can only save $2,000, and it's $3,000 for couple. This is one of those rules that is extremely outdated. When they set this level, these asset and income limits were valued much higher. And so right now there's the SSI Asset Elimination Penalty Act that is that was introduced in both the Senate and the House that is pending, that would raise the income and asset limit. We see this as critical to allowing people to save money more effectively, but also eliminating improper overpayments. Another issue that is currently being discussed a lot is in-kind support and maintenance. Again, particularly for SSI, because there are strict limits, there are also a lot of rules about what happens if anyone gives you any help at all. And Social Security will dock people up to 1/3 of their benefits if they get meals from other people or help with their rent. And some of these rules, not only are very strict and they're pretty cruel, but they're hard to administer. So there are a number of Social Security proposals that even Social Security has made to streamline this process and minimize the times when these sorts of rules come into place. There are 3 different Social Security proposals that are out right now that would minimize it. One would make it so if someone gives you a free meal, that would no longer require them to dock your benefits. Another has to do with housing, if people get some assistance with housing. And finally, in order for Social Security disability insurance, which is folks who get a disability after working for a while, there's a 5-month wait after you get your qualifying impairment before you can get these benefits. There are several efforts to eliminate that waiting period. Next slide. So another thing that I want to talk briefly about is the marriage and relationship penalty. As I discussed earlier when I talked about the max benefit, particularly on the SSI side, you may have noticed that it was different for an individual than it was for a married couple. But for Social Security, there are several rules that make it hard to get married. One is if you marry someone who is not on the same type of benefits you are receiving, you might lose your benefits entirely. And the other is if you marry someone who's on your same type of benefit, this is particularly true in the SSI context, the amount of your benefit and the asset limit may become lower. Next slide. So 2 people who receive disability adult child benefits, these are Social Security Disability Insurance or OASDI benefits. If a DAC beneficiary marries someone who is not a DAC beneficiary and isn't receiving other Title II benefits, they just lose their benefits. It just ends with marriage, which can be catastrophic, particularly if someone who's a DAC marries someone and maybe that marriage ends as well, then they can be left without any support from a spouse and they've lost their income. It just makes it much more complicated. And for 2 SSI beneficiaries, if they are married, there will be a 25% cut in how much income they get, and there's a cut in how much income and asset they can have. Now, next slide. There's another set of rules which are complicated, but if you have 2 people who get married and one receives SSI and one does not, the income from the person who is not receiving SSI can get deemed to the person or applied to the person who gets SSI. And as a result, it will often result in a reduction of benefits for the SSI recipient just because they are married. Now, this will apply the same if someone is either married or is what's called holding out. That means maybe you're not legally married, but you refer to each other as husband and wife in public and operate as if, in some cases, Social Security will treat you as if you're married, even if you're not. However, if you're not holding out, even if you are living together as a couple, but you don't refer to each other as husband and wife, if you are careful to keep some bills and other things separate, then you will not see the reduction. So not only is this problematic because it affects whether or not people decide to get married, but it makes the program pretty unequal. Next slide. So I understand this was a brief overview and I covered a lot, but only 1 inch deep. It is important to remember that more than 40% of SSI beneficiaries live below the federal poverty line, and 36% of disabled adult children beneficiaries live below the federal poverty line. And these 2 groups have the highest poverty rates of all beneficiary groups. So, as we go briefly over SSI and Social Security basics, that's why some of these policy initiatives are really important. And I appreciate you guys listening to me talk about them today. I believe I might have one more slide. Oh, sorry, 2. So this one, I just wanted to, I know I said this at the beginning, but one of the reasons these benefits are critical, among others, is they are often a pathway to Medicaid. And I think many of us know that Medicaid is extremely important for a lot of reasons. Not only is it health insurance, but it's also the only vehicle in our society for services such as primary and preventative care, for durable medical equipment, personal attendant care, supportive housing services. So, making sure this is accessible is really essential. Next slide. So I know I'm over time, but thanks again for listening, and it's a good time for you guys to move on to Grace.
We have a few questions thank you, John, in the chat. Joy, if you want to read us out.
Yeah, definitely. So in the Q&A box, Aaron asks, what is prohibiting these requirements that are outdated from being updated to reflect current wages in the internet world job types? Asset requirements from the 1980s is really outdated.
In a lot of cases, it's legislative. Like for the income and asset limits happens to be in statute, which is why there's legislation right now proposed to update them. So I mean, it's legislative and there has to be a will. You know, with the income and asset limits, we're really pleased to see that there is bipartisan interest and will to potentially change these. So hopefully there'll be a legislative process that will allow that to happen. For some of the other things, it's, you know, for the outdated jobs, the Social Security Acting Commissioner testified 2 weeks ago that they've actually been working on an update for almost 10 years. And it's a little unclear what is taking so long, since there seems to be some consensus that relying on such outdated jobs doesn't make sense. But so it is this like interesting mix of like, there are some problems with the statute, but there's also some Social Security internal policies at play here that people are trying to put pressure on to update.
And sort of a follow-up on that one, a related question. Dan asks, does it consider the plethora of work-from-home jobs in the modern era?
That's a really good question, Dan. And so there are some people who have raised that as an issue. And here I'm going to raise that with a caveat. I think, you know, there has been, particularly since COVID, this increase of flexibility of certain sorts of jobs. However, you know, when talking about whether you can do any job in the country, it needs to be a job that's pretty accessible across the country. And it is interesting, the data showing like where work from home is available, where it's not available, and what education bracket it's available to. So there's definitely, you know, the current Dictionary of Occupational Titles does not contemplate, I mean, they barely contemplate computers. They barely contemplate a fax machine. So they definitely don't talk about work from home. But it is like that is a contentious point that people are talking about, because while work from home jobs need to be considered at a certain level, there also needs to be some recognition that for a certain education level, work from home probably won't be available, and that shouldn't be used to make it seem like people can get more jobs than they can.